Welcome back to Depictions Media Radio. This next segment is from the Pan American Health Organization, and with opening remarks from Dr. Etienne, the director of PAHO from Washington, D.C., as the COVID-19 outbreak reaches its third year in the Americas. Millions of children are missing out on routine vaccinations, putting countries at risk for losing decades of immunization progress. Countries are seeing outbreaks of diseases that for years have been under control, including measles in Brazil, diphtheria in Haiti, and the Dominican Republic. So essentially, because of the inability to actually travel and to deliver goods, that includes medical supplies, which medical supplies also includes vaccinations that are used to immunize children. As we know here in Canada, that diphtheria and measles are included in the first few rounds of vaccinations given to our children here, and because those vaccinations for the most part are manufactured here in, say, Canada, between Canada and the United States, that our children don't have any problem getting a hold of these vaccines. In other countries like Brazil and in Haiti that are just mentioned, for instance, is in her opening statements, they have to be shipped from the United States or Canada to South America and then redistributed to the doctors, pediatricians, in those countries so that their children can receive those vaccinations. Some of those shipments have been halted. Some of those shipments have been halted to the point that there is a shelf life on these vaccines, and if the vaccines aren't received and
todos, bienvenidos a la conferencia de prensa.
Good morning, good afternoon to all of you. Welcome to PAHO's press briefing, the Pan American Health Organization. My name is Luciana Viegas. I am Public Affairs Advisor with PAHO, and today is Wednesday, January 26th. We have interpretation into English, Portuguese, and Spanish, and you will be able to ask your questions during the session through the Q&A button. Please remember to identify yourselves using your name and media outlet when sending your questions. Today, PAHO's director, Dr. Carissa Etienne, will be updating you on the COVID-19 situation in the Americas and will also be referring to the impact of the pandemic on children. With Dr. Etienne, we have here today Dr. Jarbas Barbosa, Assistant Director of PAHO, Dr. Ciro Ugarte, Health Emergencies Director with PAHO, and Dr. Sylvain Aldiguieri, Incident Manager for COVID-19. I give the floor now to Dr. Etienne for her opening remarks. Dr. Etienne.
And good morning to all of you. Thank you for joining today's press briefing. In the last week, more than 8 million new COVID-19 cases were reported in our region. This is the highest number of weekly cases since the pandemic started, and it is 32% higher than the previous week. Deaths throughout the region also increased, with 18,000 new deaths, marking a 37% relative increase over the prior week. In North America, the United States continues to have the highest numbers of new infections, although cases decreased by nearly 1 million over the last week. By contrast, in many of Mexico's southern states, we have seen new infections triple over the last 7 days. In Central America, where weekly fatalities were up 107% compared to the previous week, Belize is reporting the highest rates of new infections, and infections are accelerating in Honduras and Costa Rica. In South America, Paraguay and some of the Guianas are seeing COVID cases double nearly every 2 days. And infections are especially high in Bolivia, Peru, and Ecuador. Argentina reported over 797,000 cases, while Brazil's case count of 477,000 showed a 193% increase over the prior week. Meanwhile, in the Caribbean, Haiti and Martinique continue to report significant surges, as both countries also report some of the lowest vaccination coverage rates in the region. As COVID cases are spreading more actively and more quickly than ever before, it is clear that Omicron has become the predominant SARS-CoV-2 strain in our region at this moment. To better understand how this virus is progressing and to guide decisions, it is critical that countries continue to collect and use subnational and subpopulation data. The more localized the data, the better, because what's happening in a country's urban centers might not reflect the reality of its rural regions. Now more than ever, we need data about how this virus is affecting different ages, genders, groups, and geographies, so we can equip local municipalities and districts with the tools that they need to manage risk and to guide their populations during this time. These data are also critical to help countries identify gaps and target resources to ensure that the persons most at risk of severe COVID-19 disease and death are protected first. As we touch on the topic of equity, I want to share an update on the pandemic's impact on our children and adolescents. First, we should be clear. Children can get infected with COVID-19 and can transmit it to others. When sick, most children have mild disease that can be treated at home. Hospitalizations and severe cases are more frequent among children with pre-existing diseases and is rarely seen among otherwise healthy children. But because of the scale of the ongoing outbreaks, more people of all ages are becoming infected with SARS-CoV-2 virus. And because vaccinated adults are well protected against severe disease, most hospitalizations occur among the unvaccinated persons, including children. Children with comorbidities like diabetes and asthma are especially vulnerable. And while most of these children are recovering and doing well, not all of them are. But COVID isn't the only risk that our children face. Over the last 2 years, millions of kids across the Americas have missed out on their routine medical visits, leaving them behind on their routine vaccinations. In fact, vaccination coverage has dipped so low that countries are at risk of losing 2 decades of immunization progress. As a result, countries are beginning to see outbreaks of diseases that for years had been under control. Brazil, for instance, is fighting an ongoing measles outbreak, while Haiti and the Dominican Republic are combating ongoing diphtheria transmission that is threatening children's growth and development. At the same time, our children continue to face the worst educational crisis that we have ever seen in this region, with millions of children yet to return to the classroom. And with each day that children go without in-person schooling, the greater the likelihood that they drop out and never return to school, leading to lifelong consequences. Additionally, the mental and psychological health of children and adolescents is being significantly affected, which may result in long-term consequences. But we know what it takes to address these problems. The first and most important thing countries can try to do for kids is to get them safely back to school to protect their social, mental, and physical well-being. Ministries of health, education, and social protection must work together to bring as many of our children as possible back to school safely. Because virtual learning does not and cannot replace in-person schooling. For some children, schools are safe havens to learn, to socialize, to receive mental health support, and to get a nutritious meal. So as countries in the Southern Hemisphere welcome kids, teachers, and staff back to the classroom, and as countries in the Northern Hemisphere enter the flu season, we remind countries that PAHO has published detailed guidelines and considerations to facilitate the safe return to in-person learning. By promoting mask wearing and social distancing and ensuring adequate ventilation, countries can safely reopen schools. High vaccination rates among children are not a prerequisite for school reopening. We also urge parents and caretakers to get their children caught up on routine immunizations by bringing them in for their medical checkups. But of course, this rests on having these services open and available. Countries must see routine immunizations for what they are, essential. These services were critical before the pandemic, and they remain central to our COVID responses, so our children don't fall further at risk. And finally, we should talk about COVID vaccines for children. Before considering vaccinating healthy children, countries should ensure that coverage among groups at highest risk of COVID-19 disease and death is high. In many countries, particularly our Caribbean islands and territories, vaccine coverage among the elderly and at-risk groups like health workers remains low. But 12 countries and territories in the Americas have already reached WHO's 70% vaccination coverage target. In these countries, where vulnerable groups have already been protected and where additional vaccine supplies may be available, countries should consider the benefits of vaccinating children to further reduce the transmission of SARS-CoV-2. Many countries have already authorized and are safely administering COVID vaccines to adolescents. And last week, the WHO's expert group on immunization authorized Pfizer's COVID vaccine for children between the ages of 5 and 12, offering a roadmap for countries that may be ready to roll out COVID vaccines for them. As countries weigh the benefits of vaccinating children, and as they work to bring back in-person learning, I want to reinforce a point that I made earlier at the top: the need for better and more granular data. This data holds the key for how to restore or offer these services safely. Countries must act urgently so the next generation has the health, education, and social opportunities to reach their fullest potential, and so that no child or teen is left behind. Thank you.
Thank you, Dr. Etienne. We move to the questions, a question that we received from several journalists, including La Prensa, Panama, El Comercio Perú, Uno TV, Mexico, El País. Mexico is, in recent days, Hans Kluge, the WHO Regional Director for Europe, spoke about the transition to endemicity in Europe and the possibility that we are approaching the end of the pandemic. Can a similar forecast be made for Latin America after Omicron? And would we have any estimates? Dr. Etienne.
Well, thank you for this question. Of course, none of us has a crystal ball. And so it's too early to say that we are approaching the end of the pandemic. What I can say is that we have the tools to control the spread of COVID, which has been unprecedented. These tools are also effective against the Omicron variant and can help all of us control transmission. So first, get vaccinated when it is your turn, and get a booster when your country recommends it for your age group or condition. Second, continue to use caution and protect yourself from exposure to the virus. Wear a well-fitting mask with the highest protection available, especially if you are in an enclosed space. And keep a physical distance of 6 feet or more from other people, and avoid crowded spaces, especially during parties or celebrations. If you are indoors with other people, make every effort to open windows or ventilate these spaces so air can circulate. Please don't forget about hand washing. Washing your hands frequently is important, especially before you put on your mask or when you take it off. We have been urging people in the Americas to use these tools, and really they are straightforward. If we do all these things consistently, we can help reduce transmission of SARS-CoV-2, including its Omicron variant, and we will be contributing to advance the end of the pandemic. Thank you.
Thank you very much, Dr. Etienne. Pasamos a las otras preguntas de los periodistas.
We now move on to the other questions by journalists. We start with Mexico, El País. This is a long question. In Mexico, this has been a complicated winter season due to the drop in temperatures and also the push of other respiratory diseases and the arrival of Omicron. What are the challenges of the potentiality of the COVID seasonality in connection with the coexistence in our society with the virus, and also the measures that are here to stay and changes in terms of epidemiological surveillance and other diseases such as respiratory diseases that are worse in winter. Dr. Aldiguieri, I thank you for the question. This question allows us to build on what Dr. Etienne just told us in the mid and long term, and also including the seasonality of the disease. In areas with mild temperatures in North and South America, not only in Mexico, the winter season seems to be associated with increases in the incidence of COVID-19. We still need several seasons of surveillance to be able to determine whether this pattern will be clearly a seasonality. If that was the case, an important item will be to determine how the seasonality of COVID-19 would be aligned with the other acute respiratory diseases, in particular the flu. If that was the case, the main challenge would obviously be the joint burden that we could have during winter for outpatient health services as well as intensive care units. As to the new measures, and they are not new, but they have been known for several decades regarding the importance of those public health measures, we now have more experience and awareness of the benefits and also the implications of those measures, and also social distancing, and also the use of masks. It is possible that depending on the epidemic season and also the local evaluation, we might see an adoption of those public health measures with more frequency. As to epidemiological surveillance, that was part of the question from Mexico. Throughout our region, we have more than 12 years of experience monitoring the trend for flu and other respiratory viruses by using a sentinel service, which is well established and coordinated in all of the countries of the Americas. This type of surveillance would be used more than the universal surveillance of all of the acute respiratory diseases. And as a matter of fact, this is already being implemented in most of our countries. Finally, as I referred to seasons at both ends of the hemisphere, it should be mentioned that in subtropical and tropical areas, it is usually more difficult to determine the seasonal pattern of transmission of the viruses, and the new outbreaks are feasible. I hope I have addressed the various aspects of the question posed by Mexico. Thank you. Thank you, Dr. Aldiguieri. We now move on to a question by Peru regarding vaccination in children. Jason Goyabi is asking, does PAHO have information on the effectiveness of vaccines with inactivated viruses such as Sinopharm and Sinovac in children? Dr. Barbosa. Thank you for the question. There are two regulatory authorities in the region from Chile and Brazil that have already reviewed the data on Sinovac, and they have already authorized the use of the vaccines in children. It is important that whenever a country uses a vaccine, the regulatory authority may review all of the safety efficacy data that the producer has the obligation to review for this analysis. So far, we have no vaccine for children that has already been authorized by WHO. The Pfizer is the only one that has been recommended to be used in children, and we're expecting in the next couple of weeks for producers to share with WHO all of the data from the studies that they corrected to verify the quality and the efficacy of those vaccines so that there is a higher supply of vaccines for children in the Americas. Thank you. Thank you, Dr. Barbosa.
Next question from the Caribbean, from Ariel Boleg from the Tribune in the Bahamas, as well as others that I've seen in the Q&A chat, such as Trinidad and Tobago, The Guardian. A question about return to school. So I'll pose a question from the Tribune. Health officials notice higher coronavirus infection rates among children, a grouping that does not have the same broad vaccine coverage as other subsets of society. Are these indicators that school should be virtual? Dr. Ugarte?
One of the conditions to reopen schools is, of course, the vaccination of the highest level of vaccination coverage in the countries, particularly from teachers, school workers, and others. And in some countries, as you know, the governments and the national authorities have begun the vaccination of children. Although the priority is to establish the safest conditions at school settings in order to reduce transmission among children and also from spreading from the schools to the communities. Usually when the community has higher levels of transmission, the schools that are part of the communities would also report highest transmission levels and will prone to close the schools again. And that causes even a higher problem for the national authorities, particularly in the education sector. And it causes some confusion on the measures which schools will reopen, which other schools will not reopen. In that regard, we emphasize the need to return to schools, but at the safest conditions, considering many factors inside the schools that we already mentioned several times, but particularly the use of masks that has proven to reduce transmission at all levels. And the other one is, of course, to establish early detection in the schools so we can identify where the transmission is happening and to reduce the impact on school settings. At the same time, we consider that when it is not only the school itself, it's also the transit from home to school and back from the school to the homes. So those are also some other conditions that must be in place so the schools can reopen as soon as possible in the safest conditions. Thank you.
Thank you, Dr. Ugarte. Pasamos a una pregunta de
We move
Vanessa.
on now to a question by Vanessa Davis from Contrapunto in Venezuela. Her question is, how many sublineages of Omicron are circulating in the area and in Venezuela? And also whether those sublineages have a different manifestation or are a cause of concern. Dr. Aldigueri, first question, or both? The first two. Thank you. Thank you for those questions. As expected, and as we have seen with the other variants, the SARS-CoV-2 virus continues to evolve, and it's also leading to additional changes that lead to the emergence of new lineages or sublineages within the same genetic group or a variant group. Currently, in addition to the original lineage that was 1529, 3 sublineages have been described for Omicron, B1, B2, B3. BA1, the first one, BA2 or BA3. BA1 is the prevalent one in the Americas. It has been identified in 93% of the samples in North America and 87% of the samples in South America and the Caribbean. I am here referring to the samples that were sequenced dating back to December last year. BA2, which we have seen discussed in the media, has been detected mainly in Africa and in Europe. In the Americas, so far, BA2 has been detected in less than 0.1% of the samples reported to the global database. Right now, we do not have any report on the detection of sublineages, in particular in Venezuela. And finally, BA3 has only been detected in Africa, Europe, and in very, very small proportion. So I would like to mention that the technical group that is working on the viral evolution of from the WHO has been following closely the sublineages of Omicron, and so far, no evidence has been found of any change in terms of transmission and clinical manifestations or the immune response beyond the ones that were described so far. So it is important to mention that this is the same variant, and currently there are no reasons of concern, additional concern, to change the application of a public health measure or to change vaccination and social distancing. And we will report based on the new studies that are being carried out globally and regionally. Thank you.
Thank you, Dr. Aldeguerre. Vanessa has a second question about vaccines. She wants to know how many people have been vaccinated in Venezuela just with the first dose, and how many have received the whole complete schedule, and how many have received a booster. Dr. Barbosa, do you have information? Thank you for your question. The information that we have are information sent by the countries every Friday. The health ministry has information every day, but we receive the information every week so that we can consolidate all the data. So Venezuela has received more than 12 million doses of vaccines through COVAX, and they also have bilateral agreements. So the information that we have today is that over 18 million people have received the first dose, and this is 64% of the population, and 40.4% are already received the full schedule. That means over 11 million people. So we are waiting for the next installment of information from the Ministry of Health in Venezuela. Thank you, Dr. Barbosa. There is a question about isolation days and other restrictions, social restrictions. The question is from Argentina by Francisco Javier Morere, and also from Bahamas. Several countries have reduced the amount of days in isolation for people who are positive for COVID. Is this decision based on health criteria or scientific data, or is this a decision by the government based on economic criteria? And the question from Bahamas is as follows.
And enforcements. Doctor Ugarte, no sé si puede contestar las dos en una respuesta, por favor.
Está bien.
Yes, Dr. Ugarte, thank you very much. The reduction of transmission is clearly linked to detection of cases, but also to quarantine measures of symptomatic suspect cases and isolation of confirmed cases. Most of the transmission is obviously higher in those patients who are symptomatic, and because of what we've seen of studies and analysis done in the countries during the largest period of transmission, positive cases, that's where they are symptomatic. However, the measures of reducing isolation times need to be taken into consideration or judged according to the level of community transmission and the overwhelmed healthcare services. So there is a balancing act by health authorities. On the one hand, economic and social conditions, and on the other hand, health conditions and protection vis-a-vis the pandemic. And in this sense, each one of the countries analyzes their measures both nationally as well as locally and subnationally, because transmission happens not only in terms of the whole country, but in specific areas of the countries where those measures need to be adapted so that transmission can be reduced. Of course, the impact on the economy and on society of all the actions and measures taken in the different sectors are affected by reducing, when there is a reduction in the workforce, especially for critical services, and if and maintaining people in isolation longer reduces the opportunity of communities to recover more quickly. And therefore, these measures, if adopted, have to be clearly linked to an analysis of the impact of such measures in each one of the localities and in the countries. Only then can you maintain a balance between the economy, society, and the health of the population. Thank you very much. Thank you, Dr. Ugarte. Now we go to a question from Mexico. Melina Ochoa from Uno TV in Mexico City asks, on Tuesday, the Undersecretary of Health said that the COV-2 Omicron variant plus the vaccine against COVID-19 will eventually cause immunity in a large proportion of people, which could contribute to the end of the epidemic in Mexico and the world. So what do you think of this? What does PAHO think of this? The Dr. Etienne has already given us some of this answer in her remarks. And what are the sequelae of the Omicron variant? And is there any neuronal involvement and things that will affect memory? Well, let me start by saying this: either in Mexico and in other countries of the region, there's no doubt that vaccination as well as natural infection lead to increasing the immunity level of the population. And this immunity plays a significant role in defining transmission levels and severity of the disease due to COVID-19. It is difficult to anticipate in general when this mechanism will be able to sustainably control the pandemic, because its activity depends on multiple factors that can change and vary locally and by country. Regarding the second part of the question, all the variants of the SARS-2 virus, including Omicron, can cause severe or critical disease and lead to the so-called long COVID or post-COVID syndrome. The most common symptoms include fatigue, difficulty breathing, persistent cough, muscle pain, loss of taste and smell, cognitive function, and this is, I guess, where the journalist was asking about memory issues, depression and anxiety. All of these are symptoms of the post-COVID syndrome, and there are other symptoms that I won't go into right now. These symptoms may impact the daily functioning of people and may fluctuate or have relapses over time. The best way to protect against a post-COVID condition is doing all you can to avoid becoming infected with SARS-CoV-2 virus and all its variants, and to decrease its complications. And this includes, and we need to repeat it always, to get vaccinated and to continue the numerous and well-known measures, which are physical distancing, etc. And this will reduce the possibility of a person getting infected. I hope I have covered both aspects of the question by our colleague from Uno TV. Thank you. Thank you, Dr. Aldeguerri. Now we have a question from the Caribbean. Jennifer Reddock from the Montserrat Reporter and Kevin Feldman.
About Carnival. I'll read the question from Jennifer. For countries with small population size and health systems with limited resources, given the extended nature of the pandemic, how advisable are festival or carnival celebrations, keeping in mind economic, social, and mental health factors, if it is thought that both Delta and Omicron are present under conditions described as community spread? Dr. Ugarte?
Thank you, Luciana. Thank you for those questions. As I mentioned previously, national authorities have pursued the best balance possible between social and economic considerations and also the application of the transmission control measures to reach the safest feasible conditions for the population. At this stage of the evolution of the pandemic, characterized by the spread of the Omicron variant, generally associated with a milder disease but more transmissible than variants predominant in the past, the primary objectives of the response strategy to the pandemic should be the protection of the health services. Why? Because the primary concern at this moment is to save lives and reduce, of course, the overwhelming disruption of health services on COVID-19, but beyond COVID-19. And therefore, as always, the decision of national authorities to carry on or authorize social activities should be driven by the status of the capacity of the health services and the transmission, so that the health services are not overwhelmed by COVID-19 patients, but as I said, also to continue recovering all other health services for the rest of the population or the rest of the health priorities. Obviously, the main factor to take into account is the vaccination coverage of the population. So in the context where the vaccination coverage is high, there is lesser risk of overwhelming health services, as we know, because the vaccinated people will present, will not be that prone to present moderate or severe cases. So even in the presence of a more transmissible variant like Omicron. Therefore, once again, the call is for vaccination. A tool that not only protects the individual, but can also permit easing social distancing measures. Keeping low COVID-19 transmission levels and high vaccination coverage will allow our countries and communities to better recover from the harsh impact of the pandemic. And the national authorities are looking for that, but the responsibilities of each one of us to maintain all the protective measures, even if we are vaccinated. Thank you.
Thank you, Dr. Ugarte. Tenemos aquí una
Now we have a question, a follow-up of vaccination in children from Manuel Ejino from Eje Central, Mexico. Manuel asks, WHO suggests that in order to stop Omicron, it's recommending to vaccinate children from 5 to 11. Is this recommended in countries of the region, such as Mexico, that are able to do it? Dr. Barbosa. Yes, thank you. Thank you very much. Let me clarify. There is no recommendation to vaccinate children to control Omicron transmission. But what happens is that last week, the expert advisory group, which recommends WHO and PAHO, had a meeting to evaluate all data, all the new evidence, and also as the countries have more and more access in Latin America and the Caribbean and other parts of the world, then recommendations then become more and more updated. So the recommendations are now very clear that with the evidence that protection granted by vaccines, these protections decrease over time. So it's necessary to have a third dose so that the protection may be maintained even against Omicron. Vaccination needs to be in agreement with a strategy that has been discussed with all the countries. When you do not have yet broad vaccination levels in the priority groups, then the priority continues to be to vaccinate older adults, those who have chronic diseases, comorbidities, people with compromised immune systems, and then other adults, pregnant women, etc. There's a whole scale based on risk, because the first objective of vaccination is to save lives, maintain essential services working, and also support control of transmission. So during that meeting of the experts last week, a recommendation was made to use the Pfizer vaccine for children from 5 to 11 years of age, a measure that can be adopted in countries which have already achieved high vaccine levels. So if people with chronic diseases, all the adults, senior citizens, all of those priority groups have already been vaccinated, the next step is then to start vaccinating children so that they can be afforded protection as well. Thank you very much. Thank you, Dr. Barbosa. Now a question from Canada, Nicholas Pescott with Czechno.
Canada. He asks, what is the PAHO's position on testing? Should governments be testing citizens as much as possible? And if so, what is the benefit of doing that? Further to that, he adds, can you comment on British Columbia's policy regarding its testing strategy, which is basically testing a limited number of people? Dr. Aldigueri?
Thank you for the questions. First, it's important to mention that there are different testing strategies, and each country and subnational level has the authority to implement and adapt those strategies that better fit with their quickly evolving epidemiological situations. Since the beginning of the pandemic, PAHO has recommended to prioritize testing in symptomatic cases according to the case definitions and following the national guidelines. Given that the current situation is characterized by a rapid increase in the number of cases in the context of Omicron, the subsequent increase and even indiscriminate use of diagnostic tests might generate shortages that would impact negatively on the surveillance system. In this context, with the objective to maintain a rational use of the resources, PAHO has released recommendations to prioritize the sampling, focusing on suspected cases at higher risk of complications. But this includes the cases that require hospitalization due to respiratory symptoms, patients with respiratory symptoms that are among at-risk groups for worsening disease, severe disease, health professionals with respiratory symptoms, and this also would guide the decision makers in defining the time of return to work, patients who require hospitalization for other reasons to detect COVID-19 according to the regulations of each country and each institution, and finally, in professionals with respiratory symptoms that are part of essential services, such as emergency services workers. And this special point also to allow to guide them on the time to return to work. So in the context of these recommendations for a rational use of testing, the cost benefit of massive testing should be carefully assessed by the national and local authorities, especially under high incidence scenarios. And this is what we are seeing at the moment in most of the subregions of the Americas. Thank you.
Thank you, Dr. Adicheri. Pasamos a dos preguntas.
Now, two questions from Cynthia Torres from El Confidencial in Nicaragua. First question, independent physicians have reported a mild increase of respiratory cases which are suspect for COVID-19, and some have been confirmed through antigen testing with mild symptoms. Could these cases be associated to the circulation of the Omicron variant circulating in Nicaragua? And have you received in PAHO information about the presence of the variant in Nicaragua? Thank you, Luciana. Thank you, Cynthia, for this question. In the context of transmission and detection of the Omicron variant in all countries of Central America, then Nicaragua, according to official reports through the IHR guidelines, there is an increase in positive cases of COVID-19 in the country. And in summary, characterization of the positive samples that have been sequenced, most of them correspond to females, and the age group that is most affected is 30 to 50 years of age, followed by those over 50 years of age. As I've said before, according to the channels of the IHR, Nicaragua confirmed circulation of the Omicron variant, and most of these positive samples correspond to this variant, and in a lesser way to the Delta variant. As in all countries that have detected this variant, it is estimated that it will be present progressively in the country. And for this reason, it is very important for the population to be aware that it is very difficult that a variant of this kind be concentrated exclusively in one place, and therefore it is essential to maintain measures of protection, in particular the permanent adequate use of masks in public environments, keeping physical distancing, avoid crowds, especially in areas where it is very hard to where you have indoors situations where transmission is more likely to increase. But also it is essential that if a person has symptoms which are compatible with COVID-19, or there is suspicion of contact with someone who has had a disease compatible with COVID-19, it is important for the person to protect themselves more, because higher transmission occurs in closed areas, indoors, in places where people don't wear masks. And frequently, this happens at home, in restaurants, or in work areas where people don't wear masks. And we know that this variant has been, can be transmitted, or all viruses can be transmitted 48 hours before symptoms beginning. So it is very important that when you have symptoms, you report it to the health authorities. It is really a very important responsibility. Many times we associate having symptoms that are compatible with COVID-19, or if you're positive for COVID-19, this leads people to feel guilty. And many times we see those people with those symptoms as a risk. But in fact is that if we have symptoms, and if people who have those symptoms report it to others, they need to be considered very courageous individuals. We need to encourage people to share this, because to the extent that they share, they are protecting others, and those who share the information should be rewarded and helped so that levels of protection can be maintained, quarantine can be maintained. This is the responsibility of all of us. And then to stigmatize someone who has symptoms or who are infected, this is causing great problems of increasing transmission. And this goes not only for the population in Nicaragua, but for the population in our whole region, because transmission continues to be very active still. Thank you. Thank you, Dr. Ugarte. A second question from Cynthia regarding vaccination in the country. She asks if PAHO has information about how many children have completed their vaccination schedule against COVID-19 in Nicaragua. Thank you, Cynthia. Yes, Nicaragua sends every week the information, as I've said, and we have data from last Friday. So Nicaragua, to this point, has received about 5,200,000 doses through COVAX, but also Nicaragua has received donations from bilateral agreements. They also have their own purchase or program. They have advanced in vaccination in population from 5 to 11. They have provided a coverage with the first dose of 7%. And in adolescents, 600,000 doses of vaccines have been given in, and it is 78% of coverage for the adolescent group. Thank you. Thank you, Dr. Barbosa. Now, a question from Mexico. Blanca Valadez from Milenio asks why in vaccinated people, Omicron is causing deaths. How much has changed in the virus RNA? Dr. Aldeguerri and maybe Dr. Barbosa. Yes, thank you very much. I can start. Just as it has happened with other variants, including the Delta variant, even in people who are vaccinated and who have comorbidities or other risk factors, a serious form of the disease can occur, which may even lead to death. However, it has been demonstrated that the proportion of fatalities in vaccinated individuals is very low, and in particular, in the context of the intense circulation of the Omicron variant, we've seen a dramatic decrease in severity in patients who have had the full vaccination schedule, and even more so in those who have received additional doses following the national vaccination standards. Regarding changes in RNA, as we have explained in other press briefings, the genetic material of the virus has been changing in a constant process, which is totally expected and according to natural mechanisms of viral evolution. These changes are not constant through the whole virus genome. They are accumulated in those proteins that allow the virus to improve its capacity for transmission or evade the immune response. However, there is a high proportion of genetic material which is maintained and preserved to facilitate the basic functions of the virus and its maintenance in the population. Now over back to you, Luciana. Thank you. Thank you. Yes, Dr. Barbosa. Yes, I wanted to complement what was mentioned. It's important because whenever we have the death of someone who was vaccinated, people say, yeah, well, there's evidence that the vaccine doesn't work, but that's not true. For all vaccines, there's always the likelihood that some people who have immune system problems, they are not going to acquire full protection. This also happens with other vaccines as it happens with COVID-19 vaccines. But there's no doubt that in all countries, the data confirm that the risk of dying or having a severe form of the disease is much higher among people who are not vaccinated vis-a-vis those who have been vaccinated. And for example, with the country, giving an example of that has good data, and and this is the United States, the CDC has already been including the Omicron wave. The risk of dying among non-vaccinated people is 68 times higher than among people who are vaccinated. It's not 2 or 3 times, it's 68 times higher a risk of dying by someone who's not vaccinated vis-a-vis someone who has been vaccinated. And therefore, the best way to protect and save lives, no doubt, is vaccination and maintaining the measures such as using masks as well as other measures that can prevent you from becoming infected. Thank you, Dr. Aldeguerri and Barbosa, for your messages. Now we're coming to the end of our session. We have several questions about children and the situation in schools. So this is the last question in English.
Reports of increased hospitalizations in children, along with studies highlighting the impact of the pandemic on their education or the mental health. What are the measures that can be taken to help protect children from COVID-19? Dr. Etienne, the last question for you, please.
So let me thank you for your concern about children, because this is a group that is being affected, but not visibly so, because the numbers of deaths are not as large as in adults. Really, the coordination of health, education, and social services has really never been more important. And countries are making huge efforts to provide social and economic support. Teachers, childcare staff, or those working in home visiting programs have witnessed how severely the pandemic is affecting families. We know that parents or caregivers need support to manage the stressful situation of a long crisis and its consequences. So in addition to the measures to prevent transmission, it is really important that local resources are identified to connect those resources with families who are struggling. When caregivers face hardship and distress, children are also affected. Countries know the geographic areas where the needs are greater because of poverty, because of high levels of violence, or because those areas concentrate families in vulnerable situations, such as migrant families or indigenous families. Children from these areas are more affected by the pandemic. So equity must be at the center of the pandemic response. This means providing more support and resources where the needs are higher. In the 2 years we've suffered from this pandemic, we have learned that for children, a pandemic response also includes ensuring that they receive the health interventions that they need to promote health and to prevent other diseases, in addition, to COVID-19. Routine immunization, growth monitoring, promotion of breastfeeding, prevention of HIV, mother-to-child transmission, and mental health support are among the other important services that must continue. Children also need safe spaces where they can play, where they can interact with other children and adults in their family and community. All of that is involved in a comprehensive response to the pandemic. Children need those to stay healthy, to learn, and to thrive. So thank you again for joining us today. Let us continue, each of us, to play our part so that we can indeed bring this pandemic to a close and begin once again to concentrate on our development towards a better and greater future. Thank you so much.
Thank you very much, Dr. Etienne, for this final question, this final answer. A los colegas periodistas, llegamos al final de la sesión.
Colleagues, this is the end of the session. Unfortunately, we were not able to answer all the questions, but we will follow up on email. You can send your questions to mediateam@PAHO.org. And of course, you can find more information in our website about vaccine deliveries. We have links in our webpage. And thank you for being here today and being with us. And we wish you a very good week and we'll see you next week again. Thank you.
Heads, you get a coffee. Tails, you get a coffee. You get a coffee.